Thank you. Hello, good afternoon, doctors. Welcome, welcome to this webinar on the rational approach to viral respiratory tract infections. We have moderator Dr. K. Pavan Kumar with us. Welcome, sir. Welcome to this webinar. This program is brought to you by Hetero Healthcare, an innovative pharmaceutical company. For Hetero Healthcare, the journey began in 1993. We have 30 years of excellence and 36 state-of-art manufacturing facilities, 300 plus production portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally and is the largest closely held pharmaceutical company in India. Hetero Healthcare is among the largest manufacturers of ARV, APIs and FDFs in the world and has Asia's largest API manufacturing facility at SCZ Complex, Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Hetero Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered oseltamivir, favipiravir, and remdesivir to the patient, because of which in August 2020, Hetero Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, Rational Approach to Viral Respiratory Tract Infections. As I said, we have got Dr. K. Pavan Kumar with us as moderator. Dr. Pavan Kumar is Professor of Pediatrics, MNR Medical College at Consultant Pediatricians Omega Clinics. Sir is Scientific Convener, National Pedicon 2025, National Advisory Indian Pediatrics Journal, Fellowship in Allergy and Clinical Immunology, Postgraduate Diploma in Pediatric Nutrition, Postgraduate Diploma in Developmental Neurology. Sir has won several awards, including Bharat Gaurav Puraskar 2023, Best Pediatrician of the Year Award 2023, Vaidya Ratna Award in 2015, OG Outstanding Academician of the Year 2023, Dr. APJ Abdul Kalam Health and Medical Excellence Award 2021, COVID Warrior Award, Asia's International Researcher Award 2023, Eminent Doctors of South India Award, Best Researcher Award 2016, 18, 22, 23 by MNR Educational Trust, Dr. Y.R. Reddy State Gold Medal, Dr. Chandrasekhar Chaudhary Gold Medal 2009. Sir is National Award winner of Dr. V. Balagopal Raju Gold Medal for Scientific Research Paper 2010. With this brief introduction, I hand over the session to Dr. K. Pavan. Over to you, sir, and welcome once again.
Yeah, thank you, Dr. Prashant, sir. You always give the brief, detailed introduction. Thank you so much for that. Welcome, dear pediatricians who have joined this very important webinar. So I request Payal to please share the slides.
So the slide is already being shared. We can do next whenever you say.
Okay. Yes. So my dear friends, we have seen the last season how this cough has created a big havoc among the parents. Every year we see this, cough is the second most common reason for which the children visit the pediatric office. And now we are getting prepared for this monsoon. And last season we have seen how the influenza pandemic, so more like the cases have more like, when we did investigations, it has come as a positive for. So today we are going to see what is this breakthrough innovation which has happened in this area where parents come to your clinic. I think most of you might have related. The parents come to you with a complaining of not just.
I think sir is locked off, I suppose.
I think his network was a little unstable. We'll just wait for about a minute and he should connect back.
Yes. Let's come back.
Hello? Yeah, can you hear?
Yes, sir.
Yeah. So nowadays we are seeing the cough when it comes to you in your office practice. It's not a regular run-in-the-mill cough. It is something like when the parents says that this cough, the child is having the worst cough they have ever seen, and it is throughout the day and night. Please remember, you are dealing with something called influenza, the flu, and that is the worst disturbing cough. Day and night, the child will be coughing, and the parents will come to you totally exhausted, drained out, energy drained out, and they will come and request you to give something to stop the cough. And I'm going to tell something which works like a magic, and you have to experience that in your practice by prescribing that we have a very good drug thanks to hetero what they have come up with. And healthcare related challenges what we seen in the monsoon. So we can see this COVID-19. This we have seen how it has created a havoc. But though we are not diagnosing it, most of the times when more than one person in the family are suffering with similar illness, we can come to that conclusion. Influenza-like illness is what we commonly see in our office practice, which is if we here have an opportunity to diagnose that even in the clinics. So by sending that test where you can get influenza A or B or AB positive, that we can get it. So if you know, these are the common things which we face in the monsoon. Next slide, please. So this is the Indian data, which you can see the number of flu cases have been increasing day by day. And the deaths related, the recent one is 2022, where you can see 12,881 cases have been reported, because thanks to the diagnosis and thanks to the awareness among the doctors that whenever it is normal, not the regular cough, and the child is very sick and having the fever, and that cases, please get the test done and you will confirm that, this child is having a influenza. But before that only, you have a high index of suspicion, and whenever you suspect that, immediately start wonder drug what we have 8 months ago. So this one, so the number of deaths which will have because of influenza is also we need to be very careful for. So the cases have been increasing in India, and we should be prepared. Being the pediatricians of this country, we need to aware of this. Next slide. So overview of influenza in India, you can see the sizes, the number of cases have been increasing. Not only that, the death rate is also increasing. That the slide is clearly gives us an indication. So this is really alarming, and it is increasingly alarming in India nowadays. Next slide. So we know there are different types of influenza. Influenza A, influenza B, and influenza C. We need to know the difference between this. Circulating, the current circulating in humans are this influenza A, which is H1N1, and influenza A H3N2. These subtypes are there now. Because last season we have found out these two are like they are came as positive in our reports. And influenza A, please remember, it causes frequent epidemics. And the one which is going, due to minor antigenic variations, it can cause these periodic epidemics. And pandemics is mainly due to major antigenic variation. And when it does the epidemic, it is because of minor antigenic variation. This is important to understand. And influenza B also, it affects only, it's causing a local epidemics. Influenza C type. So it infects both the humans and swine. And influenza type C infection, generally they cause the mild respiratory infection and are not thought to cause epidemics. So that's why most of the vaccines usually they cover this influenza A and B, and we need to have a one drug. Once the child is infected, we need to have a drug which protects the child from both this influenza and B. So this is what is needed in our current scenario. Next slide. The transmission of flu virus, you can see that it can spread to others up to 6 feet away. Even the person who is speaking like this, better to have a mask. COVID has really taught us a lot of important preventive steps where we have really avoided most of the viral infections apart from the COVID also. So this flu, it can spread to others who are away 6 feet away. So the social distancing norm holds good for flu also. It can spread mainly by droplets like COVID when people are with flu, either they cough, sneeze, or talk also. Please remember this word, like COVID, even the talk can spread the virus to the other person. These droplets can land in the mouth or nose of the people who are nearby and are possibly inhaled by them into the lungs. People should stay away from the affected person, stay home if they are sick. It is also important to wash the hands with soap and water. Simple steps of personal hand hygiene and wearing a mask, these two can really create a lot of a decline in the case of the flu. Mostly healthy adults may be able to infect other people beginning day one, before the 1 day before symptoms, and 1 day before symptoms, and so 1 day before to up to 5 to 7 days after becoming sick. So this is the incubation period where it can spread the infection to the other children. Children may pass the virus for longer than 7 days. This is the difference which you need to know. A child who is having a flu usually spreads more than 7 days. So the duration of rest you need to advise at home is up to 7 days. Next slide. So here you can see the different symptomatic differentiation between all the different types of influenza-like illness, H1N1, SARI, and COVID-19. You can see the difference is like most likely the breathlessness part. Okay, influenza-like illness, they may not have the breathlessness part, but the flu H1N1 has the breathlessness part, and this COVID-19 also have this. But all of them have this fever, myalgia, cough, lack of energy, and sore throat, which is there to everyone. But one thing which differentiated COVID during that season is the loss of smell and loss of taste. We all aware that how we have dealt with in diagnosis COVID-19 based on that one major symptom. And diarrhea is also possible in COVID-19, but whereas we haven't seen any cases like influenza illness or H1N1. Headache is also mostly common in children with flu, and so any child who comes to you with a headache, fever, myalgia, cough, lack of energy, drained out, please think that the child is having. If the child is also having breathlessness and cough is of very high severity, do not to hesitate to start the wonder drug, which we are going to share very soon. Next slide. So the emerging warning signs, which as a pediatricians, we should warn parents as we should write on the prescription. Please write on the prescription. Don't just verbally say to them, fast breathing and, trouble breathing and bluish color skin, the cyanotic part of it, not drinking enough fluids, not waking up, or not interacting with the children, fever with rash, flu-like symptoms, usually they improve better. So if that signs are there, they should immediately bring to the notice of the pediatrician. The child who is unable to eat, has a troubled breathing and no tears while crying, significant fever, so these symptoms definitely we should alarm the doctor, and we should write down on the prescription when to they should immediately refer to doctor. So that we need to mention. Next slide, please. So we all know the complications of flu and all. And you can see the bronchitis, ear infections, otitis media, and pneumonia, ARDS, which is a dreadful complication of flu, which if you don't treat it early, it will go into total whiteout lungs, and they should go on. They will mostly these children will go on ventilator, and they are very difficult to treat even on ventilator. Very few will survive, and death is the most, which is a very scary symptom, which everybody is afraid of when dealing with the flu. Next slide, please. The treatment of influenza. This is what every pediatrician is interested. Please write down complete rest, because that will contain the child to one room, and it will not he will not spread to the other people. And please, the child will go into dehydration, simple increase in the breath rate. It will cause fluid loss, and also we need to increase fluid consumption. Cough suppressants are very difficult to use, because it's not only cough suppressants which are dextromethorphan based and all. It's very scary to use, because they can suppress our medulla center, respiratory center also. And antipyretic analgesics, please try to give as early as possible. Paracetamol, simple paracetamol is more than sufficient. But if the child is also having fever and myalgias, don't hesitate to give non-steroidal anti-inflammatory drugs. Most patients with influenza, they recover in 3 days, most of the times, fortunately. And but if they don't, they will land up in hospitals. So we need to severe cases definitely requires intravenous hydration, other supportive measures. Next slide. So treatment with antiviral drugs. This is one important point I would like to your attention for. There are two types of antiviral drugs. One is adamantase. They are like M2 ion channel blockers, adamantans. So they interfere with the hydrogen ion channel activity of the influenza A virus. Thus, they block the entry of this flu into the host cells itself. So they are, but unfortunately, they are active only against influenza A virus. And the examples are amantadine and rimantadine, which are difficult to get also. But there is one drug which is easily available, thanks to hetero people for bringing this one, the neuroaminidase inhibitors, which block the viral neuroaminidase enzyme, which is critical in releasing the virions from the infected host cells. These drugs are active against influenza A and B, which we all pediatricians want. It should cover both A and B. So this works really wonderful, and they block the viral neuraminidase enzyme, which is critical for releasing the virions. So once the virus enters and they, next slide, sir. So they enters that, they once the entire cell was loaded with this influenza virus, this enzyme is needed. So this enzyme, it inhibits that. So whatever the cells which has loaded with the virus, it won't release that viruses to the further. It will not happen. So this oseltamivir is the one wonder drug which will works like a magic in your office practice. I can confidently say, if you give this drug early, within 2 days, the worst cough can decrease by almost by 50%. So that is the power it holds. It is a very potent selective inhibitor of the neuraminidase enzyme of the influenza viruses, both A and B. That is the great thing about it. And it is oseltamivir is a product which is converted to the active form oseltamivir carboxylate in the liver. It inhibits the influenza virus replication and pathogenicity. Both will be controlled by this, and it prevents further spread of infection. That is the biggest advantage of oseltamivir. It is effective against all strains of influenza A and B, both the avian and the swine one, and also H9N2 strains. Next slide, sir. So this is the mechanism of action which I told you. Once the virus enters the cell, it will multiply inside the cell, taking the host DNA and all. And once that is done, when it releases that, this neuraminidase enzyme is needed to cleave that virus into the cell, so that it will go and attack the other cells and also other people. But this wonder drug, neuraminidase inhibitor, it blocks that release of the virus into the stream, and it will halt the viral replication itself. Next slide. So dear friends, coming to that oseltamivir, which is the first oral neuraminidase inhibitor, which is approved in more than 100 countries, which is also easily available in India. Just you need to look for that and immediately start that. And American Academy of Pediatrics, CDA and FDA approved drug. So we can use safely in our office practice. But because of lack of awareness and lack of knowledge about among the pediatricians and the doctors, we are really seeing missing this drug, and the parents are roaming to one doctor to another doctor. If you want the halt of progression from your clinic only, you don't want to lose the patient, please do not hesitate to start this medicine as early as possible. Next slide. So the drug dosage is very important. I think I request hetero people to give this laminated sheet, and because this should be kept on the tabletop. And the dose is very simple. We need to remember it is 3 mg per kg twice daily. You can give it like, if you want to do in dose 0.25 ml per kg is what you need to remember. The dosage is less than 15 kg, 60 mg per day, divided into 2 doses. Please remember, for treatment part, we will give it as a twice daily. For prophylactic part, suppose if the child who is suffering, there are other kids in the family who are like immunocompromised or who are at high risk. For them, what we have to do is we have to give once a day dose also. So definitely do not hesitate to ask, is there any children who are vulnerable from this, who can get viral infection from this child to that child. So you need to give the chemoprophylaxis also. But for chemoprophylaxis, you should continue the once a day for 10 days. That is the difference between treatment and chemoprophylaxis. For oseltamivir treatment part, we need to give twice daily, 3 mg per kg for a period of almost 5 days is sufficient. So this will give you a ready reckoner. You can just straight away, you can see the dosage and prescribe to the patients. Next slide. The clinical trials. So there are many trials which have proven that this will reduce not only the antibiotic use by 26% and influenza related complications and in antibiotic resulting in antibiotic therapy by 55%, and also hospitalization. This is very interesting to know. You can really prevent hospitalization by 60% by just giving this medicine in the right time, and it was studied in a 3,564 subjects. So please remember, this is a double control trial, which is very effective. Placebo trial, double control. 10 studies have proven that. Next slide. So it reduces the occurrence and severity of pneumonia due to H1N1 by early oseltamivir administration. How early we need to do? Please remember, when you have a high index of suspicion, immediately start as early as possible. If you do it within 48 hours, nothing like that. It works like a magic, and you can see that difference by yourself. And parents, I'm telling you, parents will thank you for giving this medicine, and you will get lot of confidence and many more patients because you have effectively identified it and treated them early. Next slide. So this is how the probability of any severity of pneumonia and probability of severe pneumonia increase usually gradually with the time of symptoms from the onset of oseltamivir administration. That's why they say earlier the better. Earlier initiation of oseltamivir administration after symptom onset itself significantly reduces the occurrence and severity of pneumonia, and it also shortened the hospitalization due to pandemic in 2009. So even when administered 48 hours after symptom onset, it showed the considerable potential decrease in the pneumonia thing. So don't not hesitate. Whenever it is started as early as possible, whenever the child comes with the worst cough, severe cough, not responding to any medicine, please do try this one. Next slide. So guideline recommendations, WHO is strongly recommending this as an empirical treatment only. So you are very safe to start. Do not hesitate to start without, if you have any queries and all, you can clarify here. Treatment should be started as soon as possible. Laboratory confirmation of influenza virus, it takes almost 1 day, 24 hours it will take. In our office practice also, we are sending them just to confirm it, not to initiate the treatment. Negative laboratory test for H1 does not exclude the diagnosis. So based on the symptom, it is worse, then please do not hesitate to start it. If high-risk individuals have been exposed to patient with influenza, consider presumptive treatment with oseltamivir. Do not hesitate to start that. Next slide. So an early empiric supportive therapy and monitoring is what is needed to fight this dangerous one. Every season we are facing this. If you are equipped with this one of the wonderful armamentarium, it will add value to us in our office practice. Empirical therapy should include a neuraminidase inhibitor for treatment of influenza when there is a local circulation. When you know that there is a history of other viruses are roaming around there in the circulation, please do not hesitate to start oseltamivir. Next slide. So in adults with community-acquired pneumonia who test positive for influenza, this is a common query. Should the treatment regimen should include antiviral therapy? Yes, definitely. Many recommendations, including American Journal of Respiratory and Critical Care Medicine, they have also clearly stated that we recommend the anti-influenza treatment such as oseltamivir. We prescribe for adults with community-acquired pneumonia who test positive for influenza in the patient setting. This is very important to understand. And oseltamivir is associated with reduced risk of death in patient hospitalized for community-acquired pneumonia who test positive for influenza. So it is always better to start within 2 days of symptom onset, or hospitalization may result in the best outcome. This everybody should understand. Next slide. If you summarize this, the proper diagnosis with high index of suspicion early treatment can prevent the flu complications because it can result in death also. You can prevent that. Empiric use of oseltamivir reduces the lower respiratory tract complications, hospitalization, and antibiotic use. Dear friends, WHO, American Thoracic Society, and Ministry of Health and Welfare, Family Welfare, they all recommends the empiric use of oseltamivir. Why are we waiting to start this when the child is clearly showing that, with the worst cough, and the parents are fed up with all the cough syrups and all? By the time they come to you, they already might have used the medicines. Do not delay the treatment. High index of suspicion, early initiation of treatment will do wonders in cases of management of flu. So do not hesitate to start that. Next slide. So with that, yeah. Yeah. Do we need to discuss
The
these
final
cases, sir?
question, sir. We come to the
Yeah,
question.
final questions. Yeah.
Yeah. So you think the incidence of viral infections has increased, especially after COVID?
Yes, sir. Because people have not following the standard protocols of social distancing and wearing the mask and personal simple hygiene of hand wash. They are not doing now. During COVID, I can say that there is a 80% reduction in not only COVID but all other viral infections in the office practice. So we have seen a sharp decline in the infections, but unfortunately, human behavior we can't change. We have gone back to our pre-COVID era, and people are still coming with that, which they can easily prevent.
But amongst the infection,
Definitely,
viral
there is an
infection,
increase.
yes, viral infections become are more
Yes, viral
prominent than
infections
bacterial
because
ones.
of schools, overcrowding, and visiting the crowded places, travel history, and the people who are already having they're coming in contact with them. So all these they contribute to this.
So, and this is very unfortunate, but the first instinct of a general practitioner or a doctor is a bacterial infection. I mean, the viral infection take a little backseat when we diagnose. I think this has changed to realize that important
Yes, sir.
bacteria.
Yes.
I mean, a child will be brought to pediatrician after a probably. Sir, are there patients who bring the child directly to the pediatrician?
Usually nowadays in the place where I practice, we see that it's very commonly they bring on
Yes,
day two and day three. This is the common time.
correct,
But
correct.
what I heard from my friends, and we have seen during our postgraduate days also, parents they try for 2 days, and if it's not
Yes,
subsiding, then they come. But fortunately, the flu won't give that time. The child will be coughing very badly and the worst
yes, yes,
cough.
yes.
So they will immediately rush to the pediatrician because they can't sleep, and the whole entire neighborhood will be awake. So they will nowadays we are seeing that they are getting the child very soon, and we are seeing the results by immediately starting the medication on time. I think we are seeing that it's coming drastically down also.
So this is very interesting what you said. The cough which doesn't respond to the normal antitussives and this, it settles very well with oseltamivir. Of course, if it is a influenza cough. And should oseltamivir be started empirically?
Yeah, dear friends, do not hesitate to start it empirically. All the guidelines said start empirically. Don't wait for investigations. As I told you, even if you send for investigations, the report comes after 24 hours. Do not wait. Start empirically. It's a very safe drug without any side effects, very little contraindications. So you can straight away use it as an empirical drug.
Apart from early initiation, are there any other factors on which clinical response depends?
So one is the early initiation, sir, and second is other comorbidities in the children, like if they are suffering with other like some kidney
Asthma.
diseases and all, where some dose titration is required. But otherwise, it's very safe drug to use, and most of the clinical response happens if you start it early. That itself will take care of everything.
How long you generally administer for both prophylaxis and treatment?
The standard protocol is for treatment only 5 days is sufficient at the dose of 3 mg per kg. And for chemoprophylaxis, it should be given for 10 days, once a day dose.
Yeah.
That is the standard guidelines which we need to follow.
Let's say that if you oseltamivir, you not only reduce the spread, you also reduce the chance of complications. You also reduce the cost of hospitalization if it's
Exactly.
initiated.
Almost that is a good number. It's a 60% decrease in hospitalization. That means
Hospitalization.
I think every pediatrician
That's
must
a,
be aware and they should start giving that immediately.
but it's a big financial burden, hospitalization.
Yes. Yes. Can prevent a lot. And I
Yes,
can tell Prashant sir, the parents will thank you for that.
correct.
The gratitude you can see in their eyes, after 2 days when they come and tell us, after giving this medicine, it really worked like a wonder. That confidence I have developed now. I will
Yes, yes.
confidently tell them this is the worst of you are using. You have used so many medicines, stop all of them. Use
Yes.
this medicine, you will see the magic. So literally they will tell that, it's like a work like magic.
And what do you feel about prescribing antibiotics currently? Somehow our GPs, I mean, we have got a habit of prescribing antibiotics, the first instinct.
So antibiotic is not the drug here, because we know that for viral infections it won't work like that. It's like
Yeah.
opening the your neighbor's door with your key. It will not happen. So when the bacteria, it's the bacteria is there. Suppose if you have seen there is a concomitant bacterial infection
Correct,
also,
correct,
like
correct.
throat, congested throat, and ear infection. If you check the ears and you found that there is a ear AOM condition is there, there is a clear
Correct.
cut indication of bacterial infection. If you found out, then definitely do not hesitate to use antibiotic. But in resource poor settings, usually in the government settings and all, they start antibiotic as a policy, IMNCI policy, and then once they know that confirmed case this is an influenza case, then they can stop safely antibiotic and continue with antivirals.
how it is tolerated in your experience, major side effects or contraindications. You did mention this,
So
but just
in
for benefit
my
of audience.
practice also, sir, I have seen that this is a very safely well tolerated drug. One is like, little bit, some kids may throw up because of the taste factors and all. But if we tell the parents that, you can give it more little diluted and make it taste less, so that will taste less. And also they can sometimes they can give with other things.
Correct.
So that will also reduce the taste factors. And but as per that, major adverse effects are not at all seen all these years, which I'm safely prescribing. There is no major adverse effects except that, one or two vomitings. And for that case, we will tell the parent that, repeat the drug again after some time.
Your overall experience, a take-home message for the doctors who have attended this.
Yeah, take home message is very clear. If you want some magical drug in the management of cough, which is worst cough, think that that case is the worst cough and the child is coughing day and night, which is equal, no diurnal, no nocturnal variation. Please immediately with high index of suspicion, start oseltamivir immediately. And please do not hesitate. Start is an empirical drug. Do not wait for investigation. That is my take home message for all of you.
Thank you so much, sir. Thank you very much, for sharing your experience. I'm sure the audience has benefited, especially treatment of cough when it's untractable cough. Thanks so much, sir, once again. And thanks for
Thank you,
taking
sir.
time and
Thank you so
attended
much.
this. Thank you for sharing your experience. Thanks. All the doctors who took time and attended
Thank
this.
you for giving
Thanks,
me the
Payal. Thanks,
opportunity to discuss
Sanjana.
with my colleagues,
Our pleasure,
to
sir.
share my
Our pleasure.
confidence in the drug and confidence in the treatment.
That's exactly
So
which
that
level
is thank you
confidence.
so much for bringing up in the syrup formulation. So we
Yeah.
don't have many syrup formulations. Thank you for bringing that to us. Yeah.
Thank you, sir. Thank you. You can log off. You want to add anything, Payal?
Yeah.
No, absolutely not. Thank you so much, sir.
Yes.
I'm sure everyone must have got a lot of brief from how oseltamivir works and how it is